No chapter. Günaydınlar.
Günaydın hocam.
Leyla hocam günaydın.
Sıkıntı yok bağlantılarda.
Günaydın hocam.
Bu yıl ikincisi düzenlenen bu ikinci Biyonet Kongremize hoş geldiniz değerli katılımcılar, değerli hocalarım. Eğer herkes katıldıysa oturumu başlatalım. Sanıyorum bir sıkıntı yok. Yine kongrede emeği geçen Damla, Ulaş, Acaröz hocalarımıza ve ekibine teşekkür ediyoruz. Gerçekten yine güzel bir kongre oluşuyor. Elinize sağlık. Evet, ilk sunumumuz Burak Karip hocamıza ait. Buradalar mı kendileri? Sanıyorum.
Kendileri buradalar ama hasta olduğu için hocam sunumu benim yapmam gerekiyor da.
Tamam. Başlayabilirsiniz eğer hazırsanız. İçeriğinizi paylaşıp. Onlar bunu yaşmamaya dikkat edelim lütfen. Siz Özlem Hanım mı?
Hocam şöyle, ben şu an sayfayı paylaşmak istiyorum da burada engellendiğiniz için paylaşamıyorsunuz şeklinde gösteriyordu. Onun engelini kaldırmanız mümkün müdür?
Tamam, şimdi hocalarımız sanırım. İçeriği paylaş diye bir şey yok mu aşağıda?
Share screen var hocam ama oraya bastığımda host disabled participant screen sharing yazıyor. Öyle olunca onayın gelmesini istiyorum.
Tamam. Damla hocam var mı öyle bir engel?
Hemen ayarlıyoruz hocam.
Tamam, sağ olun.
Tekrar deneyebilir misiniz hocam?
Evet. Teşekkür ederim.
Oluyor sanırım. Tamam.
Evet. Sunumu İngilizce mi yapacağız hocam, Türkçe mi?
İngilizce hocam.
Tamamdır. Okay, good morning everyone. Today I'm going to talk about a new membrane which we called accessory atlantoaxial ligament, and we're just looking for, is it a part of the tectorial membrane or is it a separate membrane that we can find in cervical atlantoaxial joint? So I'm just going to talk about the craniocervical junction because it is important to carrying head and also the mobility of cervical joint and also the cranial part. So we have two joints here, atlanto-occipital joint and atlanto-axial joint. An atlanto-occipital joint is joint which is carrying the occipital bone and the first vertebra of the atlas, and the atlanto-axial joint is the atlas and axis joint. And now I will just tell you about the vertebra's a bit anatomy, because when we know the anatomy, we know how the flexibilities and why it is important for the clinical work. Here, I want to tell you the atlanto-axial joint have lots of ligaments, but here is the anatomy. This is the dens, and this is the axis, and the first vertebra, it is atlas. And they have a central and the two lateral joints, which is important for the rotation of the head. Here is, you can see the dens, and here is the arc of the frontal arc of the atlas, and the posterior part of this arc and the densest frontal is have an articulation here, and this is the transverse membrane which is protecting this arc, and I will show you at the end of this presentation why this ligament is so important for surgery. And this ligament that you can see here, there is a dens, but the cruciate ligament is just closed it. Here is two alar ligaments, which is coming from dens to the occipital condyle, which is protecting over hyperextensions and flexions of the head. And because of the spinal cord, here's the apical band, which is a bit posterior of this longitudinal superior ligament, which is important because of the dens mobility. As you can see here, a crucifying ligament, which is we see transverse ligament, and the superior longitudinal band and the inferior longitudinal band. So this is the ligaments again, the tectorial membrane. As you can see, here is the dens and the apical part, and two lateral bands is alar ligaments. And the big part, which is the cut here, so you can see the inside, but the big part is the longest part is the cruciate ligament. As you can see from the lateral side, here is the occipital bones bastion. This is the back part. As you can see, this is the cruciate ligament. The tectorial membrane is protecting the spinal cord from the bones and the fragility. And also, this is the mid problem of the defining the ligaments, because some ligaments is just going with the others. So the big ligaments closing the other short ligaments like Gerber's and the Arnold's ligament. Today, I would like to talk about accessorial atlantoaxial ligament, which is obliquely from the medial part of the axis and the lateral mass of the atlas. And we have the dissection, some pictures here. This is our case report. Normally, we can see here C1 and C2 vertebrae, but we just, during the routine dissection, we take out the vertebrae and the posterior longitudinal ligament and the spinal cord, and then we take out the tectorial membrane here, and then we can see here transverse ligament and the superior longitudinal band and the inferior longitudinal band. Here, I would like to show you the accessorial atlantoaxial ligament, because we take out the tectorial membrane and then we saw this ligament. So we just want to say about this is the abnormal structure seen from the tectorial membrane, because we take it out and then we see a new one. So we told, is it the new accessorial atlantoaxial membrane, or is it a part of the tectorial membrane? As I can say, some of the literatures and some of the other studies shows that it is a bit different from the tectorial membrane. So now it is a big new adventure for the anatomical and also for the clinical studies. And I want to show you about the clinical part, because I'm the neurosurgery residency. In my clinic, we saw lots of cervical fractures. And also these ligaments just not only let the head and cervical rotations or movements, they are also protecting the spinal cord from these movements. As you can see, here is a MRI scanning from the sagittal part. Here is the dens, the part of the axis. Here you can see the fracture. This fracture is not only able to us to make a surgery, but from here you can see it is the mobility. And here you can see the tectorial membrane. It is ruptured. So this has to be so fragile. So we have to operate it. As you can see, we have a cervical stabilization, because if you don't have this stabilization, this part of the bone, because of the rupture of this tectorial membrane and transverse membrane, it will go and have injury from spinal cord. And this is my my participation, and thank you for listening and attention.
Teşekkür ederiz. Bitti sunumumuz sanırım.
Evet, teşekkür ederim.
Evet. Sırada Mine Aslan.
Hemen paylaşıyorum.
Tamam, başlayabilirsiniz siz de.
Can you see?
Yes.
Hi, I am Nerslan from Bolu Abantı Baykal University. My subject is investigation of the effect of balance and posture on speech function in stroke patients. Flow of the presentation will be background and method result combination. Background. Stroke is a focal orbital neurological deficit that develops suddenly due to the pathology in the blood circulation in the brain, less longer than 24 hours, and can result in death. After stroke, motor control disorders, tone disorders, sensory disorders, balance and posture problems, and communication disorders may occur. Body control and balance should be ensured during all daily activities. Weakness in the muscles in stroke patients causes inadequate postural control and self-deterioration of balance. Good posture is also an important factor for vocal function. Speech problems may occur after a stroke. Speech disorders that occur affect the quality of life of the individual. In a study conducted on individual with stroke, it was determined that motor and language activities were not functionally independent from each other. At the same time, it's known that pelvic stability provides trunk control, trunk stability provides head control, head stability provides jam control, and chin stability provides control of tongue movements and lip mobility. Our study aim. Now study has been taught in literature on the relationship between language and speech function in stroke patients with posture and balance, and the relationship between speech dysfunction and quality of life in stroke patients has not been examined. Therefore, the aim of our study is to determine whether there is a relationship between language and speech function and posture and balance in stroke patients, and to contribute to clinical studies and scientific research with the results obtained.
Dear Minasan, we can only see your first page. Can you manually change the pages? In our screen, we are only seeing the first one.
Bir saniye. Yeniden yapmayı.
Tamam hocam.
Şu an geçiyor mu?
Evet, şimdi geçiyor. İsterseniz böyle ilerleyin.
Tamam, böyle ilerleyelim.
Teşekkürler. Kolay gelsin. Six stroke patients diagnosed having a speech disorder and without cognitive impairments were included in the study. Also, mental test score greater than or equal to 24 means patients without cognitive impairment. Balance and postures of stroke individuals were evaluated using Berg balance test and postural assessment scale for stroke patients. The stroke and effigy quality of life 39 test was used to evaluate speech disorder experienced by individuals with stroke affect their quality of life. The Birhane effigy test tool was used to evaluate speech and language function of the individuals. Finally, objective sound analysis was performed with a mobile decibelmeter, and subjective sound analysis was performed with the sound-related quality of life scale. The mean age of the individuals participating in the study was 54.50 plus or minus 18.85. The mean of mental test score was 25.33 plus or minus 1 plus 96. According to statistical results, a significant correlation was found between the Berg balance test score and the stroke and effigy quality of life 39 scale mean score. No significant correlation was found between DBT score and GET2. However, there was a significant correlation between the AD of DBT and repetition score at GET2. A significant correlation was found between the stroke and effigy quality of life 39 scale mean score and the GET2 total score. In addition, a significant correlation was found between GET2 total score and sound-related
tools related ACBH quality of life score. Correlation. In his study conducted with stroke patients, no correlation was found between the posture and posture of the patients and their speech function. It has been observed that some balance parameters can affect speech function. As a result of the study, it was seen that balance problems and speech disorders may affect the quality of life in stroke patients. Thank you.
Teşekkür ederiz. Bitti sanırım sunumunuz.
Evet.
Tamam. Thank you for presentation. Ayhan Çalışkan. Ayhan Çalışkan.
Yes, sir. I am here.
Tamam, okay. Tamam, it's your turn.
Okay. Thank you, dear chair. Good morning, everyone. Can you see my presentation?
We can.
Okay, thank you. My name is Hamide Nur. First of all, I would like to thank the Congress Organizing Committee for giving the opportunity to present. I will present to you our study title, Academics' Opinions on Faculty Development Workshop for Writing Multiple Choice Question, a case study of the Faculty of Health Sciences. Excuse me. Wait, this, okay. The duties of the academics in higher education institutions include research, service, and training activities. Depending on the developments in the field of education in the 21st century, from lecturers are expected to be more effective, more creative, productive, and successful academics. One of the important tools for the academics in higher education institutions to continue their professional development and fulfill their duties in their institutes in faculty development programs. In this study, it's aimed to present the opinions of the participants on the multiple choice question workshop held within the scope of the faculty development program of Afyonkarahisar Health Science University, Faculty of Health Science. A descriptive cross-sectional research design was employed in the study. 33 academics who voluntarily participated on faculty development workshop event held in Afyonkarahisar Health Science University, Faculty of Health Science in October 2021 formed the sample of the research. Data collection, the workshop was conducted two consecutive online sessions via Microsoft Teams. First part, a short introduction to measurements and evaluation. The second part is formulating multiple choice questions. Before the workshop, and only 3 false tests containing a 15 statement about multiple choice questions writing was sent to the participants. Post-workshop feedback was gathered from the participants with an online questionnaire consisting of structured and 4 semi-structured open-ended items. The data analyzed using Microsoft Excel and SPSS 25 programs. Now let's look at the result parts. The frequency and percentage distribution of the participants regarding their socio-demographic characteristics such as gender, department, academic title, and length of the service in the academy are presented in table 1. You look. 33.3% of the participants work as academics in nursing, 27.3% in health management, 24.2% in nutrition and dietetics, and 15.2% in physiotherapy and rehabilitation departments. All the participants, 4 are associated professor, 14 are assistant professor, 10 are lecturers, and 5 are research assistants. The average working time of the lecturers in the academy is 7.3 years. The pretest was completed by 25 participants, and the mean score was calculated as 71% of the possible maximum score. The feedback questionnaire was completed by 21 participants. The workshop was positively endorsed by academics in all evaluation items, where 95.2% agreed that the workshop met my expectation, and 94.7% agree that after this workshop, I think I will be writing better quality multiple choice questions. Participants stated the discussing and analyzing the multiple choice question examples and interactivity during the online meeting were the most useful features of the workshop. What aspects of the training do you find the most helpful? The most frequently mentioned topics among the answer given by participants: simple question solution 8 times, question analysis 7 times, and interactive training 6 times. According to participants, these features increased the comprehensibility of the training. Conclusion: as a result, ABSU Faculty Health Science academics expressed their high satisfaction with the workshop. It has been seen that the workshop contributed to increase in awareness, knowledge, and experience in multiple choice questionnaire writing. It can be suggested that the educational competency of the academics could be supported by ensuring in the continuity of the faculty development program on a variety of topics in either online or face-to-face training. Thank you so much for your attention.
Thank you. Dear Baudidi.
I'm here.
Evet, turn your it's turn your please. Yes.
I want to
Okay.
just 1 second. I want to.
First, you need to open your presentation.
Yes, I want to, but I
Then
think I
click
had a little
to
problem
screen
here.
share. Or we are waiting.
I have a little problem. I can't. I can't share with you my presentation. I don't know why.
Maybe we can pass the other person, then during that time you solve
I
the
will try
problem.
to. Yes. Okay.
Leyla'cığım
Thank you.
uygunsa Okan Anıl Aydın'a geçelim hocam.
Tamam.
Arkadaş teknik problemi çözene kadar.
Tamam.
We're going to pass to Okan Anıl Aydın. During that time, Aymane is going to solve the problem.
O kanalı. Feray var bir de sırada hocam. Feray Çağıran.
Feray Çağıran henüz internetten giriyor düşüyor hocam. Onu ayarlamaya çalışıyor da.
Kanalı da yok sanırım. Bir alttakine mi geçelim?
Olur hocam. Volkan Şah.
Günaydın.
Sizin hazırsa.
Sesim geliyor mu hocam?
Evet, evet.
Tamam. Evet. Ekranım görünüyor mu?
Evet.
Good morning, dear moderator and participating academics. I would like to present my last study, Comparative Effects of Radial and Focused Extracorporeal Shockwave Therapies in
Günaydınlar. Kusura bakmayın Volkan Hocam. Ben 2 saniye içeri gidip gelmişim de kaçırdım sanırım. Sizden sonra müsaitseniz ben atabilirsem süper olur. O kanaldaydın 6 numaradaki kişi. Evet.
Hocam sıradan ilerliyoruz. Olmayan eksiklerimiz de var. Siz yine salonda bekleyin.
Eyvallah, tamam, teşekkürler, sağ olun.
Kolay gelsin.
The coccyx is the most distal bone of the spine and got this name because it resembles the beak of a bird called cuckoo in Latin. The coccyx usually consists of 3, 4, or 5 segments. Pain in the coccyx area is called coccydynia. It can be aggravated prolonged sitting without changing position and triggered while getting from sitting to standing up, defecation, and sexual intercourse. Although it can be detected in individuals of all ages and genders, the female-male ratio is approximately 5 and is more common in adolescents and adults compared to children.
Dear respected Professor Shah, can you reopen your presentation because we are just seeing the first presentation? Hocam şimdi ilerliyor hocam, evet.
Tamam.
Demin yaptığımızda ilerliyor ama şimdi hala ilkindeyiz.
Tamam. Geçti mi hocam şöyle ikincisine?
Geçiyor hocam şimdi.
Tamam.
Çok teşekkür ederiz.
Rica ederim. The most common cause of coccydynia is direct falls on the coccyx or recurrent microtraumas, labor or spinal traumas during surgery, degenerative joint or disc disease, hypermobility or hypomobility of the sacrococcygeal joint are also common causes. Extracorporeal shock wave therapy is based on the application of acoustic waves created outside the body to the desired surface of the body. ESWT was first used in Germany in 1980 to break up urinary stones. The ESWT device was first applied in treatment of orthopedic problems in 1993. ESWT application is now widely used in the treatment of musculoskeletal problems such as calcaneal spur, lateral epicondylitis, patellar tendonitis, Achilles tendonitis, and calcific shoulder tendonitis. Extracorporeal shock wave therapy is used as 2 different wave types called radial and focused ESWT in the treatment of musculoskeletal disease. In studies to date, one of these 2 different wave types has been preferred in the treatment of coccydynia with ESWT, but it has not been specified on which scientific evidence this preference was made. Therefore, in our study, we tried to compare the effects of radial ESWT and focused ESWT on coccydynia and to determine which should be the first choice. 60 patients with coccydynia were equally in each group. The patient number was 20. Randomized into 3 groups according to different wave types of ESWT, focused, radial, and sham. Sham means placebo. A total of 4 sessions of ESWT at 1-week intervals were applied to the sacrococcygeal area by the same physiotherapist and with the same device. Our device was Elettronica Pagani, made in Italy. In side-lying position by bringing the hip and knee to the maximum flexion degree that the patient. Focus ESWT was applied to the first group with 8 Hz frequency, 1.8 bar pressure, 1,500 pulses, 3 minutes and 8 seconds duration per session. Radial ESWT was applied to the second group with the same frequency, with the same pulses, but 1.6 bar pressure and the same time duration. Sham ESWT was applied to the third group, 1 Hz frequency, 1 bar pressure, and 1,500 pulses shock waves. In radial and focused ESWT, the energy level ranged from 0.02 to 0.60 joules, which the device automatically adjusted. Since sham ESWT was a placebo treatment, the energy level was manually set to 0. Patients in all 3 groups were questioned with visual analog scale, shortly WAS, and Oswestry Disability Index, shortly ODI, scales before treatment. And this is the baseline. After completion of 4 sessions of the treatment, this is week 4, 1 month after treatment, this is week 8, and 3 months after treatment, and this is week 16. The severity of pain felt by the patients at rest and during activity was evaluated with WAS. 0 is no pain, and the 10 is worst possible pain. ODI was used to assess functional status in coccyx pain. This questionnaire includes activities such as self-care, walking, sitting, sleeping, standing, weightlifting, social life, and travel. Its maximum score is 100. An increase in the score indicates an increase in the functional limitation, while a decrease in the score indicates an increase in the functional level. A total of 60 patients, 10 of them are male and 50 of them female, are included in the study. The means of the age and body mass index are 36 and 26 respectively. Focus ESWT, radial ESWT, and sham ESWT were applied 20 patients in each group. Mean WAS values at 8 and 16 weeks were significantly lower in radial and focus ESWT groups compared to the baseline. The WAS scores of the 4th week were significantly decreased only in the radial ESWT group when compared with the baseline. There was no significant change in WAS scores in any control group, in any control week compared to baseline in the sham ESWT group. When we made the statistical analysis, the results showed that intergroup and intragroup differences of WAS scores in this table. ODI scores were found to be significantly lower in the focus ESWT and radial ESWT groups at the 8th and 16th weeks compared to baseline. The decrease in ODI scores in the radial group at week 16 was significantly greater than the decrease in ODI scores in the focus ESWT group. In the sham ESWT group, no significant ODI score change was detected at any control week compared to the baseline. And this table shows the ODI differences, intragroup and intergroup changes. We found that both radial ESWT and focus ESWT were effective in treating coccygynia compared to sham ESWT. However, radial ESWT was significantly superior to focused ESWT in WAS values at week 4 and ODI scores at week 16, according to the results of our study. It can be predicted that radial ESWT may be more effective in the treatment of coccygynia and therefore should be the first choice. Thank you for listening.
Thank you for the presentation. Teşekkür ederiz.
Rica ederim hocam.
Katıldı sanıyorum. Sağ olun.
Evet hocam.
Tamam, sizi alalım o zaman. Ya da siz vardınız.
Benden mi bahsediyorsunuz hocam?
Yok, Ferhat.
Ha, tamam, teşekkürler.
Ben sizin.
Bağlantıda sıkıntısı var herhalde hocam. Görünüyor burada ama.
Yok, sesi de geldi.
Hi Çağran, can you hear us?
Geldi.
Beni duyabiliyor musunuz hocam?
Duyuyoruz hocam.
Merhaba.
Ama görüntünüz yok, ekran paylaşımınız yok.
Şimdi onu da açıyorum hocam. Merhabalar.
Merhabalar. Buyurun lütfen hazırsa. Sunumunuz görünmüyor.
Hocam onu açmaya çalışıyorum bir saniye.
Tamam.
Şimdi görünüyor herhalde, evet.
Buyurun.
Determination of the relationship between premenstrual syndrome frequency and BMI in adolescents. Introduction, the relationship between the menstrual cycle, mood, and behavioral change was discovered as early as 1931. Frank stated that many of the physical and physiological changes observed in the menstrual cycle may be due to the hormonal changes. After Frank's discovery, researchers have linked physical, emotional, and behavioral change, including aggression, to the menstrual cycle. In one of the first studies, it was found that most women experience intense nervousness and irritability 3 and 5 days before menstruation. The observed emotional and behavioral symptoms were named premenstrual syndrome and PMC. PMC is adolescence is under-recognized and possibly under-treated. Not adopting a healthy lifestyle, lack of physical activity, poor diet, and obesity cause many health problems. There is evidence that one of the health problems is PMC. This cross-sectional study aims to examine the relationship between body mass index, BMI, values of adolescents, and PMC. Material and method, this cross-sectional study was conducted with 450 adolescents living in the province of Elazığ, age 20 and 18 years, who voluntarily agreed to participate in this study. The premenstrual syndrome scale was used in our study. And we take anthropometric measurements. Body weight and height measurements were taken in adolescents, and body mass index was calculated. Height for age and body mass index values were evaluated using the WHO Anthro Plus program and WHO reference values for children age 5 and 19 years, 2007. Premenstrual syndrome scale was using in our study. Premenstrual syndrome scale, PMSS, is a 44 items and 5-point Likert type scale developed by Genç Doğan. Results, the first table is the general characteristics of adolescents. Our study, the adolescents' mean age was 15.6, and the vast majority of the adolescents go to school. Only 4% of adolescents smoke. There is, and the majority of adolescents sleep 6 and 8 hours. There is, and all adolescents menstruate. The second table is the anthropometric measurements of adolescents. We take the adolescents' weight, height, and we calculated the BMI values. The average body weight was 55.3, and the average height was 162.3, and the average BMI was 21.0. The third table was BMI classification of adolescents. Although the BMI values of the majority of adolescents were within the normal age, there is, the frequency of slightly overweight and obese adolescents was also found to be quite high, 41.8. It was, I think, a high in the province of Elazığ. The table 4 is PMC total score and PMC classification of adolescents. In this study, it was determined that all adolescents experience PMC. I think it's an important conclusion. It has been found that 54% of adolescents experience intermediate PMC. There is, and I think it's high. Five table is PMC total scores of adolescents according to the BMI classification. In this study, it was determined that the prevalence of PMC increased as the BMI value, and it was statistically important. BMI increased, PMC increased too in this study. Conclusion, as the BMI value increases, the increase is PMS levels in adolescents draws attention to the control of body weight in this period. It's very important. Gaining healthy eating habits will not only reduce PMC levels in adolescents, but also protect them against chronic diseases that may occur in the future. A healthy diet, regular exercise, avoidance of stressful events, and gaining healthy sleep habits, especially in the premenstrual period, will be effective in reducing the level of PMC. Thank you for your listening.
Thank you for presentation. Teşekkür ederiz.
Ben teşekkür ederim.
Bozidi. To hear.
Did you hear me?
Yes.
Perfect. Hello, everyone. I'm pleased to participate with you in the second International Congress on Biological and Health Science, in which I will share with you a part of my results concerning the clinical and the genetic investigation of 3 Moroccan families with Retinitis pigmentosa phenotypes. Retinitis pigmentosa is an inherited retinal dystrophy. The retina, which is the site that converts the light energy collected from the environment into an electrical signal, which is then sent to the brain via the optic nerve for interpretation. The RP, or retinitis pigmentosa, is characterized by the loss of the photoreceptor cell, more pronounced in the root than cones, which they ensure the dark and light vision, respectively. The RP is the most frequent ERD, with 1 per 40,000 persons affected worldwide. The earliest symptom in RP patient is night blindness, also called nyclotopia. The visual field is marked by a progressive alteration of the peripheral vision, ultimately leading to a tunnel vision, a predominantly loss of road over the cone in early stage, but the loss of cones can occur later. In fundus, we found an attenuation of retinal vessels, bone speckle-like pigmentation, and a pallor of optic nerve head. More than 80 genes are implicated in the non-syndromic RP. This distributed as follows: 31 for autosomic dominant pattern, 66 for autosomic recessive pattern, and 3 X-linked genes discovered so far. The relative contribution of RP genes show that genes like USH2A, RPGR, EYS are the most frequently mutated. At this moment, only 7 Moroccan families were genetically characterized. In a population with 39 million inhabitants, we can expect that at least 970,050 RP individuals. The Moroccan population is genetically underdiagnosed. The objective of our project is to expand the genetic diagnosis of RP in Morocco and constitute a well-characterized Moroccan cohort. For that, we recruited 3 Moroccan families with RP, 2 of which were consanguineous. To make a genetic diagnosis, the proband DNA underwent a whole exome sequencing at BGI-Tech solution, and to select candidates or pathogenic candidate variant, we focused on genes known to cause RP, available on Retinitis databases. Homozygous and heterozygous compound missense, nonsense, frameshift, and splice site variant with an allele frequency inferior to 0.01 using SNP databases such as the Mill Genome Project and NOMAD were then examined. The pathogenicity of candidate variant was evaluated with SIFT, polyphen, mutation taster, and splice site mutation were analyzed by human splicing finder. The index patient of RP, the RP1 family presented a night blindness and difficulty perceiving sight objects at 10 years of age, and ERG response of both rod and cone photoreceptor were not detectable at 20 years of age. The whole exome sequencing identified a heterozygous compound variant in the CRB1 gene that correspond to two missense amino acid chains in the exon 6. These two variants were predicted to have a damaging effect by polyphen, SIFT, and mutation taster. The index patient of the family RP2 is born to a consanguineous parent. At 9 years of age, he presented night blindness, difficulty perceiving sight objects, and ERG response of rod and cone photoreceptor were not detectable. Also, the macular OCT showed a cystoid macular edema in both eyes and the loss of the ellipsoid zone outside the fovea, reflecting the loss of photoreceptor. The whole exome sequencing analysis identified a splice site variant at homozygous stage in the PD-cis beta gene that affect the donor site according to human splice finder and disease causing according to mutation taster. The variants were found at heterozygous stage in parents and at homozygous stage in the proband. The patient of the child family is born to a consanguineous parent also. At 8 years of age, he experienced night blindness, and at 21 years of age, he had a severe impairment of the entire visual field with the persistence of a tubular vision. ERG traces were consistently altered in both scotopic and photopic. The fundus showed a grayish white aspects in the retinal periphery, slight papilla on the temporal area, and decreased retinal vessel size. The macular OCT showed a relative preservation of the foveal structure and disorganization of ellipsoid zone in the perifovea in both eyes. The whole exome sequencing identified two missense chains in the proband in the ABCA4 gene. One is inherited from the father and the second is inherited from the mother. Both variants were rare and predicted to be pathogenic. In conclusion, we report the first application of mutation in genes like CRB1 and ABCA4 in Moroccan individuals with RP. All patients had root and cone abnormalities, suggesting that cone degeneration occurred after that of the roots, those leading to classification of these diseases as a true RP. These data contribute to expanding the genetic diagnosis of RP in Moroccan family. Before I finish, I want to thank my teamwork and PhD Topical for financial support. Thank you for listening. I want to thank also the committee organization for
Thank you for presentation. Sırada Anıl Aydın burada mı acaba?
Buradayım hocam. Merhabalar, günaydın. İsterseniz ben hemen başlayayım. Özür dilerim. Hemen paylaşıyorum. Görülüyordur umarım.
Ya, evet. Siz görünmüyorsunuz gibi ama.
Ben de şimdi görüneceğim, bir saniye. Şöyle. Günaydınlar tekrardan. Tam ekran yapacağım size şimdi. Sıkıntı yok herhalde, başlıyorum isterseniz. Good morning to everyone. I'll present my presentation. It's the title of my present, the effect of psychological violence perception on job satisfaction in healthcare professionals. Psychological violence is the practice of psychological terror by one or more people in systematic, vindictive, and immoral way. Job satisfaction is the ability of the employee to earn financial profit and enjoy from work. The aim of the study is to reveal the effect of mobbing perception on job satisfaction of health workers. While the population of the resource is the health workers in health institutions in Kocaeli province, the sample consists of 199 participants. A questionnaire based on the online method technique was used to collect data in this study. In the first part of the questionnaire, there are 7 statements for the socio-demographic information of the participants. In the second part of the questionnaire, the physical terrorism chart scale developed by Lehman was used. In the last part of the questionnaire, Minnesota job satisfaction scale was used. In the analysis...
Pardon, slaytınız ilerlemiyor.
Öyle mi? Özür
Evet.
dilerim. O zaman şöyle böyle gidiyor mu peki? Şöyle
Evet.
bakıyorum.
Aynen.
Herhalde yine diğer çalışmalar olduğu gibi. O zaman
Tamam.
metodumun şu kısmına geleyim. Buraya en son anlattım. Devam ediyorum.
Tamam, buyurun.
In the analysis of data, independent samples t-test, one-way ANOVA, correlation and regression analysis were applied in the SPSS 22 analysis program. Reliability analysis results for both scales were found to be high reliable. The data is suitable for other analysis. When we look at the socio-demographic characteristics of participants, the general socio-demographic characteristics of the participants are as follows. Most of them are women, 40 to 49 years old, have an associated degree, nurse, married, working in the same institution for over 20 years. The total mean of the mobbing scale is quite low degree. The mean of the 5 subdimensions of the mobbing scale were also found to be quite low. The general mean of the job satisfaction scale and its 2 subdimensions was found to be moderate degree. As a result of the correlation analysis, a statistically significant relationship was found between mobbing perception and job satisfaction. The relationship was found between subdimensions that external job satisfaction and mobbing towards social relations. As a result of regression analysis, there is a statistically significant effect between mobbing perception and job satisfaction. When we look at the significant effects, it is between job satisfaction with mobbing to show oneself and prevent communication with others, and mobbing towards social relations subdimensions. Mobbing perception explains 6.1% of external job satisfaction, and also there is a significant effect between the total scale job satisfaction and subdimensions of mobbing to show oneself and prevent communication with others. As we look at the study's fundamental results, mobbing perception average mobbing perception average was found to be quite low, and this is a good result. Job satisfaction was found to be moderate and should be increased. Lastly, motivation of the health workers due to their job satisfaction is negatively affected by mobbing. As a result of this effect, both health workers are expected to show lower job satisfaction and performance, and the satisfaction of patients will decrease. In order to get off this cycle, it is recommended to be understanding on both sides. Thank you for listening, my teachers.
Thank you for presentation. Teşekkür ederiz. Sağ ol.
Yazılır.
Hava Bektaş burada mı acaba? Sıradaki.
Evet hocam, buradayım.
Buyurun.
Merhabalar. Paylaşıyorum hocam hemen. Hocam paylaşım oldu mu?
Hayır, olmadı henüz. Böyle güzel renkler görüyoruz.
Bekletiyorum lütfen, kusuruma bakmayın.
Yok, bekliyoruz.
New Share yapıyorum hocam. Desktop'a gidiyorum. New Share'la. Share diyorum ama desktop'u açmıyor.
Hocam ilk başta slaytınızın açık olması gerekiyor. Açın ve daha sonra masa üstüne küçültün hocam.
Öyle mi?
Simge durumuna küçültmeniz gerekiyor ilk başta, yoksa açılmıyor.
Öyle mi hocam? Tamam.
Ve sanırım bilgisayarınız Apple hocam. Biz bazen Apple'larda problem yaşıyoruz.
Hocam sormayın. Apple'da yaşadığım problemin haddi hesabı yok. Kullanmaya devam ediyorum.
Desktop'a küçültün hocam. İsterseniz hani teknik problemi çözemezsek bir başkasına geçeriz. O sırada ayarlamaya çalışırsınız.
Sayın hocam, olmadı. Kusuruma bakmayın.
Başka bilgisayar bulma şansınız var mı hocam? Biz size en son atsak.
En sona atmayın hocam. Ben elimden geleni yapayım. Olur mu?
Tamamdır.
Teşekkür
Teknik
ederim.
problemi çözünce haber verin hocam bize.
Çok teşekkür ederim. Sağ olun.
Thank you. Hava hocam, isterseniz Mehmet Sağlam'ı Leyla hocam.
Tamam. Buradaysa alalım. Mehmet Sağlam buradasınız.
Yes, I'm here.
It's your turn.
All right. Can you see my presentation?
Yes.
All right. I'm gonna present using of modified external fixator in extremities long bone fractures in cats. And today living area of large portion of people are large cities. However, the number of domestic animals are increased. When you look at the picture, the cats is so good. High-rise buildings and increased traffic is mostly the reason of the traumatic lesion in cats. And the cats love to hanging out in the house. When you look at the picture, we are seeing. Fractures of the long bones of extremities in cats has a large percentage in the total traumatic lesions. The aim provide functional improvement as soon as possible. And we have already put it in the picture as an X-rays photos. And for this purpose, fixation techniques are highly developed and studies continues on this topic. And cheeks was recovered by some internal fixation. The aim of external fixation was divided as four groups. The first one is applied compression, applied neutralization, applied distraction, applied compression, and neutralization, both of them. And types of external fixators: unilateral, and it's called type 1 and half pin, bilateral, type 2 and full pin, trilateral, type 3 and multi-pin, circular, and it's called Elizarov techniques. And when we look at this picture, we are seeing the external fixations type. And unilateral external fixation, type 1, it's called an half pin, as I said before, is applied on only one side of the bone. In mechanical sense, this system is one of the weakest compared with other systems. Had to develop different strategies like tip 1EB and one tip TE1. And we put in this the external fixation in the left side and the other side in the right side. And bilateral external fixation type 2 and full pin is one of the most frequently used method in fracture of the diaphysis and antebrachium and tibia. In this system, parallel 2 bars and totally 4 and 6 transfixation pin is used. Insertion direction of these transfixion pins have to be perpendicular to the bone cortex. And type A and type B, and bilateral external fixation. The most trilateral external fixation is called type 3, and we call it also multipile. The most difficult and complicated external fixation system. Type 3 external fixation system is formed by the addition of type 1 A to type 2 bilateral external fixator. Trilateral bars are used in this system, each connected to each other. In mechanical sense, this technique is 10 times stronger than type 1 external fixation. And we are believing that this external fixation is so strong for the small animals. Provides axial compression and is used in larger animals that require more rigid stabilization. And you look the picture is so strong and so rigid stabilization. Circular external fixation, as I said before, is called the Ilizarov techniques. Circular fixation is used in difficult fractures like comminuted fractures of if closed reduction is necessary. Circular fixation allows fast bone recovery. And like that. And the back of the left side of the cat legs, and when we look that one. And material and methods, and this study was carried on 20 cats and different gender, range, age, and humerus fraction and 3, and antebrachium fraction is 3 and also, and femur 6, and tibia fraction is 8. And mostly we see that tibia fraction is mostly common happens. Fixation was made with modified external fixator application in 20 cases, as I said before. Modified external fixator as implant, 2 mm Steinmann or Schanz pin and hollow bolt. And we are using that equipment for recovery and some surgeries techniques and external fixator. And when we look at these pet animals, and we are using that techniques like that one, and the right pictures is cleared what we are doing. And also external fixation on the left side, and also the opposite X-rays photos, and also external fixator what it's doing there. And discussion. And applying external fixation and pin together provides stronger stabilization, especially in comminutive and or open fractures. External fixation system can be modified for increased strength and stiffness if necessary. In this study, a modified external fixation system is used to increase strength and stiffness. To adapt this system to cats for reducing volume and weight, this implant was made of the steel and aluminum. Fractures of the long bones of extremities in cats has a large percentage in the total traumatic lesions. The aim provide functional improvement as soon as possible. External fixation blocks shearing, compression, destruction, and torsional force. Thank you for your listening. I am to be here to be sharing some information about my topic. Thank you so much for your patience.
Thank you for presentation. Özlem Koç burada mı acaba?
Buradayım hocam.
Bu ekran az önceki ekran mı sanki ya?
Hocam görünüyor mu sunumu?
Yok. Şimdi geldi, tamam.
Peki hocam bir geçişleri kontrol edelim. İlerliyor mu acaba? Şu an ilerliyor mu?
Şuradan aşağı doğru bir inseniz.
Şöyle.
Evet, böyle ilerliyor.
Tamam.
Buyurun.
Başlayayım mı hocam?
Evet, buyurun.
Good morning, everybody. Welcome to my presentation. My name is Özlem. I am lecturer at Fırat University. Today, the topic of my presentation is the religious attitudes of midwifery students towards euthanasia. First of all, what is euthanasia? Euthanasia refers to the medical termination of the life of the patient who has the live and untreatable disease that raises feelings of sympathy in others by the demand of the patient. So it's seen that euthanasia attracts both criticism and support. In the United States of America, while active euthanasia is prohibited, passive euthanasia is practiced in some states. While euthanasia is legally allowed in the Netherlands, Belgium, and Luxembourg, it is an illegal practice in many countries. For example, in Turkey, it's completely prohibited by law. Euthanasia-related attitudes are affected by age, gender, legal regulation, personal values, and religious belief. Many studies carried out with health professionals in different cultures have found a positive relationship between religious devotion and euthanasia. Students of departments of midwifery might encounter dying patients and have to provide care for them at the clinics they will be working in the future. Therefore, it is important to determine the attitudes of midwifery students about euthanasia and factors that affect these attitudes. What is the aim of the study? The study was carried out to determine the relationship between the attitudes of midwifery students about euthanasia and their religious attitudes. So which materials and methods did we use? Population and sample for the cross-sectional study was administered between November and December 2021. The population of the resource consists of students studying in the Department of Midwifery, Faculty of Health Science, a university. Power analysis was performed with the G-Power program to calculate the sample size. The resource was completed with 218 for volunteer midwifery students. Collection and analysis of data, department students were sent online, for example, email, WhatsApp, and those who volunteered to participate in the resource were asked to fill out the forms. Which forms we used? Resource data will be collected using the descriptive information form and health professional euthanasia attitude scale and then of religious attitude scale. The SPSS 323.0 package program was used to analyze the collected data. At the end of the study, we found that the mean age of the participants was about 20. It was determined that 85.2% of the students did not want to be euthanized for themselves and 87.7% for their relatives. And then, in addition, 37.7% of the students reported that active euthanasia and 43% of the students should not have passive euthanasia. 46.8% of those who think that active euthanasia should not be applied or who are undecided about it. And 42.3% of those who think that passive euthanasia should not be applied or who are undecided about this issue cited that it is because of their conscientious discomfort. Finally, the mean total HPEAS score of the participants was found as about 80-30, while their mean total ORASI score was determined as about 34. Accordingly, the participants had moderate attitudes about supporting euthanasia, while their religious attitudes were positive. Finally, so that brings me to the end of my presentation. In conclusion, as a result of this study, it was observed that most of the students had negative attitudes toward euthanasia. And one of the factors that affected these attitudes of theirs was religious belief. Midwifery students are among the healthcare professionals in the future. Hence, it might be stated that, that there is a need for more studies about the factors that influence their attitudes about euthanasia. For the listening, thank you. I hope you enjoyed it. Thank you so much for your attention and time.
Teşekkür ederiz for presentation. Havva Bektaş, hazır mısınız acaba? Çözebildiniz mi sorunu? Havva Hanım.
Hala uğraşıyor galiba hocam.
Aynen, biz o zaman
Ama uygunsa olabilir hocam. Aradakilerde internet problemi var hala.
Şey mi? Ayman Bala Mustafa.
13 hocam. Sana Kurşit.
Tamam.
Havva Bektaş bir açtı hocam ama.
Tamam.
Hocam merhabalar.
I'm Sana Khurshid.
Sana Kurşit ilk yapalım isterseniz.
Öyle yap.
Yes,
Tamam.
I can present now.
Yeah, you can. Please.
Okay.
And share your screen.
Okay.
Havva hocam sizi kapatıyoruz Sana Kurşit'ten sonra.
Hocam benim oldu mu peki?
Açıyor hocam, gördük biz ekranınızı.
Tamam, teşekkür ederim hocam, sağ ol.
Yes,
Can you
Sana
see my
Kurşit.
slides?
Yeah, we are seeing.
Okay,
But
should I
please,
start?
can you change it if we see or not?
Is it presenting?
Yeah, it's presenting. Perfect. Thank you. Good luck.
Okay, thank you. Good morning, everyone. I'm Sana Khurshid. I'm presenting this presentation entitled Endothelial Nitric Oxide Synthase Glutamic Acid 298 Aspartic Acid Polymorphism Genotyping in Patients of End-Stage Renal Disease on behalf of me, Muhammad Babar and Muhammad Yasin. First of all, introduction. End-stage renal disease is a gradual loss of kidney function over a period of time. And usually its patients suffer from kidney failure or they have to lead to the kidney transplant. Most of the causes of these end-stage renal diseases are diabetes mellitus and hypertension. Nitric oxide synthase is a family of enzymes that catalyzes production of nitric oxide from arginine. There are basically three isoforms of these. Number one is NOS, NO2, and NO3. All of them, they are produced at different rates and different tissues of the cell. Our concern is with the NOS. Among the three isoforms, eNOS is the most likely to be associated with hypertension, coronary artery disease, and end-stage renal disease. One important polymorphism of eNOS3 gene is glutamic acid 894 substitution to aspartic acid at and mostly it has been recommended in the preeclampsia, chronic heart disease, and coronary heart disease. Our aim of these studies was whether this polymorphism is also associated in end-stage renal disease, especially in Pakistani population, because no study has been done before on Pakistani population before that. So for methodology, we collected blood samples, 150 from normal people, healthy people that fit on our criteria, and 150 end-stage renal disease people. Then their DNA was extracted through salting out method, and detection of this DNA was done through gel electrophoresis as well as nanodrop technique. And then certain gene region of eNOS was amplified through PCR, through specific primers, and to check whether which of the nucleotide is present at that site. BAN2 restriction enzyme was used, and then we also measured level of nitric oxide in normal in serum of these patients as well. These are the primers that were used during the amplification of eNOS region. Coming towards the results, here you can see after extraction of DNA, PCR was done, which amplified the certain region of eNOS gene. The size of the amplified product was almost 457 base pairs, and you can see it is just line the 500 base pair ladder. After amplification, the PCR product was used for restriction analysis, and an enzyme which was BAN2 was used to restrict this. And using this enzyme, you can see in lane 1, there is the result of T genotype. In lane 2 lane 3 shows the heterozygous, in which the DNA is cut and into the original size, as well as into smaller fragments of 250 and few base pairs. After doing the statistical analysis, we found the genotype of GG genotype was 54. This is among the control or healthy persons. The TG genotype was 66, TT 30, while in the patient, it was almost the same ratio. You can see that GG genotype is 60, TG is 69, TT is 21. So as you can see, by looking at the stats, there's no drastic difference between the control genotype and the patient genotype, and the statistical analysis through chi-square also showed that there is no significant difference between the patients and the normal person for this kind of polymorphism. If you go to the allelic frequency, then the patients in patient G guanine allele was 189, while in control was 174, while T alleles were 111 and 126. The chi-square showed that there is no difference between patients or normal for this polymorphism. Then we also done the to detect the serum level of nitric oxide, because in normal patient there is certain level of nitric oxide, but when we studied the serum patient on the level in the blood of patients, we noted that the carrier of the carrier of T allele, which was a wild mutant allele, the level was more reduced as compared to control. So we concluded that there may be this polymorphism may cause effect in the expression of eNOS gene, but not at that level that we can say that this gene polymorphism is responsible for increase or decrease in the rate of eNOS gene. So the controversies in the result is maybe due to the difference in genetic makeup of different population, because in different population, the result has been shown as a positive. The allelic frequencies and genotype frequency were not statistically different in patient and control, and p-value was found 0.72. So we conclude that this polymorphism is not involved in end-stage renal disease at least in Pakistani patients. Thank you so much. I think it was too quick.
For presentation. Havva Hanım, Havva Bektaş, alalım mı sizi?
Hocam olabilir. Paylaşıyorum. Evet hocam, başlıyorum.
Yes, please.
I am Havva Bektaş. I'm working as a lecturer one 100. Yıl University, Faculty of Medicine, Department Biophysics. 5G technology is dangerous for the kidneys of diabetic patients. Electromagnetic pollution, EM pollution, has become an important environmental problem worldwide, especially over the last decade. Cell phones, wireless internet providers, and other wireless communication sources are important factors that rapidly increase EM pollution in today's world. Research results on the health effects of RFR emitted by wireless communication sources are of increasing concern to the public every day. Studies conducted on RFR exposure have reported that causes adverse effects such as disturbed metabolic processes, cancers, cardiovascular disease, DNA damage, increase in free radical level, and oxidative stress, obesity, and diabetes. In our country and in the world, the 3.5 gigahertz frequency band, which is the most suitable band to meet both coverage and high speed capacity needs, is accepted. For this reason, 3.5 gigahertz RF signals were used in our study. In this study, it was investigated whether 5G technology caused toxic effects in kidneys of healthy and diabetic rats with histopathological analysis. The study was carried out on 28 visceral albino adult male rats by dividing them into 4 groups: healthy sham and equal 7, healthy 5G exposure and equal 7, diabetic sham and equal 7, diabetic 5G exposure 5 and equal 7. In the diabetic groups, the diabetes mellitus was induced with 45 milligram per kilogram STZ. Rats in the exposure group were exposed to 3.5 gigahertz RFR for 2 hours per day, 5 days a week for 1 month. The same procedure was applied to the rats in the sham groups, except the generator was turned off. It was observed that kidney tissues of rats in healthy sham and healthy 5G groups had normal histological structure, tubular dilatation, enlargement of filtration range, atrophy of tubular microvilli were observed in diabetic sham and diabetic exposure groups compared to the control group. However, these changes were found to be higher in the diabetic exposure group according to diabetic sham group. In relation to histopathological alterations, Hassan et al. Reported that exposure to RFR caused mononuclear cellular aggregates and intense venous congestion compared to the control mice. Moreover, it was demonstrated that RFR exposure induced many atrophied glomeruli, infiltration of leukocytes between the tubulus of the kidney and vacuolation of some tubulus. Chan et al. Stated that RFR exposure causes shrunken glomeruli and irregular kidney tubules. It's a well-known fact that RFR lead to oxidative stress by increasing level of free radicals. Oxidative stress is an important phenomenon in radiation-induced tissue damage. The histopathological changes observed in this study may be due to oxidative stress caused by both RFR and diabetes. This study, which is a preliminary investigation, indicated that exposure to 5G RFR could lead to degenerative changes on kidney histopathology of diabetic rats. Comprehensive long-term studies at the molecular level are definitely required in order to draw precise conclusions. Thank you for listening to me.
Evet. Thank you for presentation. Teşekkür ederiz. Allah hocam.
Ben teşekkür ederim hocam. Sağ olun.
Tamam. Roman Okrimenko.
Hello, can you hear me?
Yes.
Okay.
Evet. Presentation open. Yes.
Yes. Hello, dear juries, participants, and listeners. As far as you know, the war in Ukraine is going on right now in the moment. I'm asking you, if you know how to help, please help. If you don't know, please learn the way to help. So to our theme, the diagnostic potential of three-dimensional imaging in orthopedic dentistry. Recently, the technology of scanning object with obtaining a virtual three-dimensional copy has become extremely widespread in numerous fields. The development of the ground photogrammetry principles has contributed to its active introduction into medicine. The purpose of the investigation to determine experimentally the diagnostic possibilities of head and face photogrammetry under the condition of a clinical visit of a dentist orthopedist. The tasks to study scientific literature on the practical experience of using photogrammetry of the head and face in dentistry, to experiment with the process of head and face photogrammetry using a computer-based three-dimensional model, to study the possibility of obtaining numerical data on the photogrammetric characteristics of the surface of the human face. Stereophotogrammetry variant was considered to be a reliable and accurate tool for morphological assessment of moist tissue in comparison with 2D imaging and laser scanning. Gallardo and co-authors have concluded that these methods have the clinically acceptable trueness and should be reliable tools for planning aesthetic restorations. In vivo experiment was carried out with the voluntary participation of the authors of the study, third-year students. The camera of the iPhone 8 smartphone was used for photogrammetry. The main problem which was solved was the difficulty and duration of creation of textured 3D model of the object. So here we have the study of creation 3D model. To carry out the measurements on the model before shooting, we placed on the surface of the object a line of known length with the limits of the scene. Here you can see the point cloud start stage, dense point cloud stage, and the final model. That's the cephalometric points that we used in our experiment: Gnesium, Stomian, Gonian, Gnation, and Zigen. Here we marked the cephalometric points and measurements. To calculate the face type according to Garson, we use the formula below. Calculation the face type, we used morphological haste and width of the face in cheekbone area. The contents index for Garson is 19.6. We concluded that the shape of face according to Garson is narrow. Here we have video of process as point cloud stage, dense point cloud stage, align model, and here textured final model of the face. We synthesized from our practice some rules for photographing to create a more accurate 3D model. Photographing should be in a well-lit room with minimal to zero glare. Shooting in 3 horizontal trajectories. The trajectory of the camera creates an imaginary semicircle centered on the bridge of the nose with radius of 1.5 meters. Horizontal shooting trajectories differ in the face of the camera trajectory and the angle of direction to the face. Each next photo contains more than 40% of the object of the previous one. 9 photos are allocated to the upper and lower horizontal trajectory. Each subsequent photo is taken when the camera moves 20% of the radius from the center of semicircle to the place of previous taken photo. Only one horizontal trajectory consists of 20 photos. 5 photos needed from the level of the head bone to the bridge of the nose, and 5 photos from a bigger from the center semicircle distance of 3 or 4 meters. So, informativeness of the photogrammetry methods for use in the practical evidence has been experimentally proven. The optimal photographing algorithms for obtaining models was experimentally invented. Photography techniques were tested for further creation of face 3D models. Condition and algorithms of head and face photogrammetry have been developed and verified. Considering essential economic availability and competitiveness from the diagnostic value point of view and informativeness of the present method, its upgrading should take place in the direction of maximum adaptation to stomatological specificity. So here we have our literature, and thank you for listening. If you have any questions, please.
Yes. Thank you for presentation. Nice.
Thank you.
Sıradaki Mustafa Kırca. Burada mısınız hocam?
Evet, buradayım hocam.
Sizi alalım, buyurun.
Evet.
Evet, yolunda her şey tamam.
Okay. Good morning, everyone. Today I'm going to present my study, a preliminary study, temlit sertan and irbesatan augment glyoxylase 1 activity and glutathione concentration. Hereby I am Dr. Mustafa Kırca from Shayat Sciences University Medical Faculty. Diabetes mellitus is a global health problem, and according to International Diabetes Federation projections, Turkey will be in the top 10 countries in terms of number of diabetic patients in 2045. The problem with the diabetes, as you know, is the diabetic complications, and the source of the diabetic complications is the high glucose concentration in the blood. The glucose molecule is metabolized by glycolysis pathway, as you know, and there is a leakage, and the molecule methyl glyoxal is produced. Methyl glyoxal is a small reactive molecule, as we can see at the top of the page. Carries both aldehyde and a ketone group, so it's very reactive, and the accumulation of the methyl glyoxal molecule causes a problem called as the carbonate stress, and MGO, I will call it as MGO. MGO is detected as elevated 5 to 6 fold in type 1 diabetes mellitus patients, and according to some studies, 2 to 3 folds in type 2 diabetes mellitus patients. elevated MGO causes the carbon stress, and it also causes, actually results in enhanced advanced glycated end products formation. In a healthy organism or in a healthy human, it's not a problem because methyl glyoxal is detoxified 99%, more than 99% by the glyoxalase system. Methyl glyoxal molecule is a very ancient molecule actually, but in recent years it has gained, it became very attractive, and many studies has been done. It's related with many pathological conditions from atherosclerosis, hypertension, etc. Glyoxal system detoxifies this methyl glyoxal molecule, and the main enzyme of the system is glyoxalase 1 enzyme. Glyoxalase 1 enzyme, by using reduced glutathione as a cofactor, converts the toxic methyl glyoxalide to non-toxic D-lactic acid molecule. Why? Because the glyoxalase 1 enzyme use GCH, reduced glutathione as a cofactor. Glyoxalase 1 activity is in parallel to GSH, glutathione concentration. And also, I said methyl glyoxal is related with hypertension. It has been shown in the literature it causes hypertension. So by how it do this? By it induces renin-angiotensin system, so it induces hypertension. So antihypertensive drugs like telmisartan and irbesartan were suggested to be protective against methyl glyoxal. I do this research in vascular smooth muscle cells. These cells are important because they play a prominent role in vascular pathophysiology such as atherosclerosis, hypertension, and restenosis. The aim of this preliminary study was to explore whether MGO affects GLO1 activity and GSH concentration under standard or norm or low glucose concentration or high glucose concentration, because high glucose concentration in cell culture models is accepted as a diabetic hyperglycemia model. So I did it in two different cell culture media, and to determine the potential protective roles of telmisartan and irbesartan. These cells, vascular smooth muscle cells, isolate from supraspinatus right aorta and passages 3 to 5 were used. Cells were induced by 200 micromolar of MGO in low glucose or high glucose media for 48 hours after starvation. Telmisartan and or irbesartan were applied as 10 micromolar concentration at least before 30 minutes before MGO treatment, and they are cell culture made in low glucose media 5.5 millimolar or high glucose media 25 millimolar concentration. The main reason behind this, high glucose provokes, increases methyl glyoxal concentration. Yes. Glyoxalase 1 activity was determined by glyoxalase 1 activity kit. GSH reduced glutathione concentration was measured by colorimetric assay kit, and statistical analysis were done appropriately. When we look at the results, in standard glucose concentration, glyoxalase 1 MGO, when we applied MGO, glyoxalase 1 activity is not changed, But when we apply telmisartan and irbesartan, glyoxylase 1 activity is found elevated. When we look at the glyoxylase 1 activity after MGO methylglyoxide induction, it has found glyoxylase 1 activity is found elevated in contrast to low glucose. In there is no change. There is no significant change in terms of glyoxylase 1 activity. But in high glucose, I found elevated glyoxylase 1 activity. Telmisartan and irbesartan in here also were found effective 30% and 17% elevated respectively. I said before, reduced glutathione concentration is parallel to glyoxylase 1 activity. So, to confirm, also confirming and as another parameter, I measured the reduced glutathione concentration in standard glycose media. There is no change in GSH glutathione concentration in standard glucose concentration when we applied methyl glyoxal. Telmisartan and irbesartan were found effective to increase the reduced glutathione concentration. When we do the same experiment in high glucose concentration, in similar to glyoxylase 1 activity, reduced glutathione concentration after MGO induction was found and hence elevated. Telmisartan and irbesartan were also found effective to increase, to augment glutathione concentration. The same data can be presented like that. So I put these images because how glyoxylase 1 activity and reduced glutathione concentration in standard glucose we can compare, because I said twice these are in parallel to each one. What I mean, if reduced glutathione concentration is elevated, glyoxylase 1 activity increase is weighted. They are in parallel to each other. So in standard low glucose concentration, MGO induction stimulation did not cause a glyoxylase 1 activity and GSH concentration. Telmisartan and irbesartan were found effective to increase both. In high glycose media, a small but significant increase in glyoxylase 1 activity and GSH concentration when we applied MGO, when we applied methyl glyoxal, and telmisartan and irbesartan addition to the cell culture media before MGO induction caused a more elevation in GLO1 activity and GSH concentration. So as an highlight, MGO elevated GLO1 activity and GSH concentration in high glucose, but not in standard or low glucose media. Telmisartan and irbesartan augmented GLO1 activity in both media. There is no significant change between telmisartan and irbesartan. I mean, none of them is superior to the other one. GSH concentration is proportional to MGO activity. My results support this well-known phenomenon. MGO induces GLO1 activity and GSH elevation in high glucose might result from high substrate flux, because here high glucose presence in the cell culture media it makes hard to be detoxified by the glyoxylase system of MGO. Yes, my study showed angiotensin II receptor blockers, telmisartan and irbesartan. These are very widely prescribed antihypertensive medications. These are augmented glycosyl-1 activity and GSH concentration effectively. Enhanced GLO-1 activity may be the result of elevated GSH levels. Other receptor blockers might display a similar effect because, as you know, sartan family antihypertensive drugs consist of 8 different drugs, telmisartan and irbesartan, 2 of them. Others, valsartan, olmesartan, losartan, etc. As a conclusion, prescribing telmisartan and irbesartan to hypertensive diabetic patients could provide additional benefit against MGO-induced decarbonous and diabetic complications. Of course, further studies are needed to fully understand renin-angiotensin and glycosyl system relationship, especially in vivo and human studies. Limitations of my study: 1 dose and 1 incubation time. As I said, this is a preliminary study. Number of measurements, an in vitro study, and only 1 method-based observations. And here are my references. Thank you for sparing time. And lastly, I would like to thank the organizing committee for organizing this event. And yes.
Presentation. Teşekkür ederiz. Hocam, sunumlarımız.
Hocam sunumlarımız tamamlandı. 2 kişi katılamadı, bağlanamadılar. Evet. İsterseniz birini bir tekrar anons edelim ama yok burada. Ayman Balla Mustafa, are you here? Yok hocam, burada bağlanamadı.
Aynen, bir de 12. o da yok.
Evet, Voronkova da yok hocam.
Aynen.
İkisi dışında tamamız hocam. Çok teşekkür ederiz Leyla hocam emekleriniz için. I would like to thank the Professor Leyla Mis from Van Yüzyıl University, and also we would like to thank everybody for their contribution to our Congress. And saat 3.30'da bu salonda devam edeceğiz hocam. 3.30'a kadar salon A'dayız. Salon A'da davetli konuşmacılarla devam edeceğiz. At 3:30, 3:30, we are here, and during that time we will be at Hall A for invited speakers. Thank you very much for your presentations. And if there is any questions, you can type here, or you can directly ask to the researchers, and in chat box you can find their email address. Sayın hocalarım, chat kısmına hocalarımız mail adreslerini de yazdılar. Sorularınız eğer şimdi olmaz, daha sonra aklınıza gelirse direkt hocalarımızla da iletişime geçebilirsiniz. Katkılarınız için çok teşekkür ederiz.
Herkese...
Leyla hocam tekrar çok teşekkürler.
Sağ olun.
Görüşmek üzere.
Hoşçakalın, teşekkürler.